This is a patient who's 81 years old who's had this venous stasis ulceration apparently for 20 years. It was hard for me to believe that when I first heard the story, but she was seeing a vascular surgeon once or twice a week who was changing her dressings. She's had Una boots and has nurses that come to her house at least once or twice a week and change these dressings. She hasn't had anything else done. She had an endovenous ablation procedure which has apparently worked, and had seen the doctor and follow up, and the doctor said nothing else could be done. He wanted to continue the same old treatment regimen. When we saw this patient in reevaluation, we re-scanned her leg and found that the great saphenous vein had recanalized, and that there was severe reflux extending into it. So we ablated that with the endovenous laser, the EVLT Never Touch VenaCure procedure, and she claims that this ulcer right here, which was confluent, has healed. It's been about 2 to 3 months now that we've done this procedure, and then this ulcer here has become shallower. You can see here that it's closer to the skin, deeper in the middle. Unfortunately, no attempt was made with this ulcer in the past to have it grafted with skin graft or anything else. So here's someone who's lived 20 years with an ulcer that should have been taken care of many years ago. You can also see, if you look at the foot, that there's swelling of the foot and swelling of the toes, so she has some secondary lymphedema, and also the trophic changes in the legs are very remarkable. You can see areas from chronic venous insufficiency where there is hypopigmentation, or it's light colored, and hyperpigmentation where it's darker colored. So this is very typical for lipodermatosclerosis. Lipodermatosclerosis is when there's shrinkage of the leg. You can see at this leg compared to the right leg. The right leg has more proper form. It tapers off the way it should. There is some lipodermatosclerosis here, but on this, all of this has shrunken. The skin is very leathery and hard, and so that's characteristic of what lipodermatosclerosis is. Literally, is lipo is fat, dermato is skin, sclerosis is thickening, and you can see how it basically comes off almost like a, I don't like to say it, but like a pirate's leg, the wooden legs, and you can see how it tapers off very quickly. It's very hard. But the characterization of hypopigmentation, hyperpigmentation, and shrinking is very characteristic of this condition before people get ulcers. She also has an ulcer on the outside of the ankle, and these are also getting smaller. So it's going to take time. I've told this patient that it may take up to 2 years for it to heal, but since it is a very clean base, if we can get the swelling under control, which has been the case, we can probably have her skin grafted and hope for this thing to heal.